I'm here to announce that we'll soon be safely easing the restrictions in place in long-term care and all other continuing care facilities in the province. Nearly all continuing care residents and the staff, majority of staff, are now vaccinated with a double dose administered more than 2 weeks ago, which dramatically reduces their chance of infection and serious illness from COVID-19. So today, it's safe for us to take a step forward. As of May 10th, we'll implement a new public health order to safely ease continuing care restrictions across the province. This new public health order will increase the number of designated support persons who can be part of their loved one's care team in a continuing care facility from 2 to 4 people. And it will allow facilities to have small indoor and larger outdoor visitations if residents feel it's safe to do so. Minister Chandra will provide more details in just a moment. But I want to emphasize that this is a safe and prudent step forward. We're not getting rid of all of the restrictions at continuing care facilities. There will continue to be limits on who can visit and how many, and strong outbreak protocols will remain in place. There are no risk-free options, but we've heard loud and clear from residents and families that they want this change.
We first brought in strict restrictions in continuing care facilities last spring to help limit the spread of the virus and to keep the residents safe. And we've continued to update them throughout the pandemic. With the change that we are announcing today, each resident will be able to have up to 4 people as designated family or support persons, and previously it was 2. Also, where possible, and provided that the majority of residents agree, indoor social visits with up to 4 visitors will be able to resume again, as long as they're all from the same household and they follow distancing, masking, and other health measures. And finally, outdoor social visits in these facilities will expand to 10 people, including the resident. And these changes are not mandatory. They need the agreement of residents because these are more than care facilities, they're people's homes. And so this will vary site by site. And each site must work with their residents to develop their own visiting approach within the guidelines that are set out in the order. And this will take time, so these changes will not take effect until, as Premier said, May 10th. And this is a cautious but safe way to make life a little bit better for mothers and fathers, for parents and grandparents. And as Premier said, this is all possible thanks to the vaccines and our vaccination program. It also reflects the dedication of the operators and their staff of these continuing care facilities. To take just one example, they've all achieved compliance with the order that staff work at a single site, 100% of these care facilities. And that was a huge challenge for all of them, but they've done it.